After a few years of not having success becoming pregnant, my husband and I decided to look into the option of doing IVF. Exciting to think about some of the benefits of doing IVF versus natural conception. I think one of the things that was a question was about my age. I'm 42 when we started this treatment. It was nice to be able to do the testing and ensure that we had a normal chromosome, which I believe truly was a large part of the success. I had a lot of questions for Dr. Sasiya, but I was really impressed with her level of confidence and knowledge about the procedure, and also her confidence in treating me as a woman with advanced maternal age. And she was able to put a lot of that to rest for me and really make me feel more comfortable with a lot of the questions that I had ahead of time. I think one of the most important things was understanding that it's possible to become pregnant after 40. It's very possible. It's just a matter of, making sure that the hormones are settled, and of course that you get a healthy chromosome.
She has a quite poor ovarian reserve, low fertility function. About the result of the anti-Mullerian hormone is quite low. We try to stimulate her eggs and keep her egg out in the IVF technology. If the embryo is quite low amount, only 1 or 2 embryo, we try to stimulate again in the next cycle, maybe 2 or 3 cycles for accumulated embryos, and then send to check the chromosome analysis. The result is quite good. Every cycle we got the many embryo, and the result of the chromosome testing show many normal embryos. So we freeze and then try to embryo transfer in the frozen cycle. In the first cycle of frozen transfer, we success.
We were really excited because the first time that we did the embryo transfer, it was successful. Well, we've had 2 4D ultrasounds. The first one was around 20 weeks, and exciting to see the baby in real time. But it was a big difference between 20 weeks and 32 weeks when we checked again, because the baby had a lot more facial fat and just looked more like a baby that's ready to be born. You could see 10 fingers, 10 toes. All the anatomy was the way that the heart functions and the organs. We could see in a much more depth the health of the baby.
Now, many women marry or plan to have a baby age over 35 years old. So we recommend to counseling with our center for preconceptional. If the problem of the fertility function, maybe we can counseling about the fertility treatment.
If you are wondering if IVF is right for you, or you're having trouble conceiving, or just interested in having a successful outcome to pregnancy, choosing gender or choosing a healthy embryo, I would highly recommend doing an IVF procedure and coming to Bangkok Hospital, Phuket for that, because the professionals here, the doctors here are all very excellent. I was lucky to see almost every one of them at my visits and have all of my questions answered in a way that made me feel very comfortable and confident choosing to do IVF here.